Hello, welcome to Neuro Tips. We're going to talk about malignant infarct today. Neuro Tips are for medical professionals. We provide useful information within a few minutes. Malignant infarct is a massive stroke with severe edema. It occurs in less than 10% of the ischemic stroke, usually involving the middle cerebral artery. Mortality rate is over 78%. There's a higher chance of hemorrhagic conversion from the infarct and is more commonly seen in younger patients. The main symptoms are headache, hemiparesis, and the patient will develop progressive decline in level of consciousness from increasing edema. On CT scan, it can show that over 50% of middle cerebral artery distribution ischemic changes. And on follow-up CT scan, it can show progressive increase in edema and producing midline shift. On this scan, it shows a large left middle cerebral artery distribution infarct with a midline shift. Treatment options. If patient is not a TPA candidate, we should consider ICU care and consider intubation and keep systolic blood pressure under 220 unless there's a hemorrhagic conversion. Elevate head of bed 30 degrees, give patient aspirin by suppository or by NG tube, and also continue to provide general care for the stroke, control blood sugar, and treat fever, and provide VTE prophylaxis. When the patient develops increased intracranial pressure, we'll try to maintain a PCO2 between 26 to 30. We can consider giving mannitol, loading dose of 1 gram per kilogram, followed by 0.5 gram per kilogram every 6 to 8 hours. Or we can also use 3% saline with continuous infusion and keep the sodium between 145 to 155. These medications should be given by a central line. Surgical treatment. Sometimes a hemicraniectomy is performed to remove part of the skull to reduce brain pressure. It will improve survival rate, but it will not reverse severe neurological deficit. This is a CT scan showing that part of the skull bone is being removed. After surgical treatment, the patient may continue to have severe neurological deficit due to the very large stroke. If the dominant hemisphere is involved, the patient will have permanent severe aphasia and dense hemiparesis. When the non-dominant hemisphere is involved, it can also have dense hemiparesis, cognitive impairment, and some speech impairment. References are mainly from Progressive Medicine and UpToDate.com. Thank you for your attention. Bye. We'll see you again soon.